Giving back to those who serve our country. That's the mission of the Military Partnership Program at Scottsdale Healthcare. It's all about training reservists from all branches of the armed forces to take care of themselves and their fellow military personnel in the line of duty. Here's more.
So reservists are a readiness team for the United States. They have to actually go to a wartime setting. They have to be ready to go. Normally they work 1 weekend a month and 2 weeks a year, and the rest of their time they're in a civilian job like the rest of us. Only 40% of them have a medical job in their civilian world, so they're not prepared to go in a deployed setting, and most deployed settings are actually trauma settings. So what we offer them here in our hospital is the ability to have simulation labs that focus on that trauma training. Can you imagine how difficult it would be for a teacher or an accountant or a salesperson that's what they do in their civilian job, to transition to 1 weekend a month or 2 weeks a year into a setting where they had to save lives, let alone if they were deployed and sent to a war-type setting and then had to rescue people when this isn't what they do in their real life every day. This is their reserve job, and it's important that they know it well. Scottsdale Healthcare has a simulation lab, and the whole focus was military training. Our whole focus was, how can we train the military to have the trauma skills that they need in a wartime setting? We have all types of military that come here, both active duty and reservist. All branches of the service are welcome here. And we try to make it very generic so it can mimic anything that maybe someone in the Navy or the Air Force or the Army might see. It's not going to be exactly like their setting, but it's something that they could actually see.
We can take a person who has had very little training, they have basic training, and we can train them up as part of our program to get their skill levels where they are competent and comfortable and confident in those skills to be able to help anybody who they come in contact with, either during their active military duty or their reserve duty.
Adults learn hands-on. We can watch a PowerPoint, we can read it in a book, or maybe even watch a movie. But I will tell you that if you don't get your hands dirty and really touch a patient in a situation like this, it's very difficult to really feel what you have to do for them, to really understand the interventions that it takes to save a person's life when they're facing these kind of critical injuries.
The reservists, they'll shadow us, they'll work with us hand in hand so that we're training them hands-on. They're not just watching, they're not just learning from afar, they're actually doing all those skills with us, which is really great. Your mother said common sense is half the battle of life. You know what? Same thing in medicine. We teach common sense. We can teach people how to take care of the injured without any training at all.
And we give them a small scenario, a very basic piece of information. What happened to this patient? He was in some type of an event, a firefight, and have some injuries, very limited care. So now they come in dressed and ready to go in their protective equipment, and they have to rush in and respond to this patient. At first they may think that this training, it's just a mannequin. It has a heart rate, it hemorrhages, it bleeds, it looks like an injury. And then they start to flip that switch from mannequin to patient. And that's a big difference, because then you get that critical thinking. They have to think, okay, what do I do next? What is his biggest problem? How do I save this patient's life? And it doesn't matter if they're saving a life on a mannequin or a real person. At that point, they're saving a life, and that's the training that they need when they go downrange in a wartime setting where somebody in their team gets injured.
We can rock their world and create any scenarios where they have that skill set, where they have the confidence and the competence to complete those tasks. And it's just a great full circle where the simulation helps us with protecting them as well as protecting people, so that when they do work on the people, they've got it nailed down.
This is intense stuff. When you watch them in training, what happens is you see how they start with a very seriously injured patient. They have to rapidly assess what those injuries are and treat them. From there, they have to do all kinds of interventions, treating for shock, give them oxygen, start an IV, and dress the wounds and the hemorrhaging that you see. If they don't do these life-threatening things within the first few minutes, this patient is not going to survive.
Not a lot of time to think at all. You kind of just got to go through, they teach you, airway, breathing, circulation, you think about that, and then you kind of go on autopilot, and that just takes over.
Communication is one of the most important things. You hear the team talking back and forth. Not everybody is an expert, and not everybody has all the answers, so they have to talk back and forth, communicate their findings, and then their interventions. From there, then they can create other interventions or package that patient to get them to a higher level of care, perhaps a hospital.
It's all about communication and teamwork. You're not going to save a patient by yourself. You're just not. It doesn't matter if you're the best doctor, the best nurse, the best medical technician in the world. You've got to have an effective team. And that's pretty much what this experience has been focused on. You know, if you're in an ER, everybody's saying, grab this, grab an IV, grab a catheter. And it's the experience of communication and practice on a patient.
We serve those that serve us, and that's our mission, and that's why it's so important to me and to the team here at Scottsdale Healthcare, because we want to give back to our military that are serving us, and we want them to have all of the training that they need to take care of their other military counterparts in a bad situation.
All right, so we're off to a quick break, but